Thanks so much for having me. So I'm here to talk about integrative therapies and symptom management. So we'll cover some of the more natural therapies for some of the common cancer symptoms related to cancer. And we'll also go over the benefits and risks, including the efficacy of natural therapies, the safety, the side effects, drug interactions, cost. And then we'll go over the small changes we can make to improve our symptoms. So I'm starting with these primers because I read a lot of self-improvement literature that states positive input improves individual performance. So these are selfishly for me. Joshua Rosenthal of the Institute of Integrative Nutrition would call these primary food. And primary food can be loosely defined as any positive, non-edible input, such as inspirational messages, relationships, social connections, exercise, touch, or anything that really feeds your soul. And when we're lacking in primary food, we end up looking something like this. I don't think she feels very good. So when I was asked to do this talk, I sort of panicked because I candidly don't have decades of experience like some of my more seasoned colleagues. So I bought a book and I read the guidelines, and then I sent them a desperate email for help. Only half of them answered, but it's nice to have some support there. But since I looked into the integrative oncology guidelines in the book, I wanted to start with the definition of integrative oncology. And it's the rational, evidence-based combination of conventional therapies with complementary interventions into an individualized therapeutic regimen that addresses the whole person living with and beyond cancer, body, mind, and spirit. So if integrative therapies are based on evidence, how are they different from conventional therapies? Well, the main difference is that integrative therapies are natural supplements, cannot be patented in a similar manner compared to the conventional pharmaceuticals. So there's a lot less funding for them. That's why in 1998, the NIH created the National Center for Complementary and Integrative Health to help us gain more funding for higher quality research. So I'm going to start off with some more bad news or precautionary news about natural supplements, and then we'll get on to the funner stuff later on in the talk. So some of the myths, many people believe that if it's natural, then it must be safe. But the truth is that many substances in nature we know are toxic or potentially even lethal. And these include tobacco smoke, scorpion venom, poisonous mushrooms, or even certain bodily processes that at least seem toxic. Integrative medicine doctors can take into account your medical history, the efficacy of the supplements, and can also look at interactions with chemotherapy. So usually providers will advise you to avoid most herbs and supplements while you're going through chemotherapy. That being said, there are some supplements that can enhance chemotherapy side effects or at least decrease side effects, but these specific combinations must be monitored by a physician. Some centers offer more invasive natural therapies like IV vitamin C, but IVs are not without risk. The risks are often outweighed by the benefits of high quality supported conventional medicines, but with the natural therapies that have lower quality evidence, we don't necessarily know that these risks are outweighed by the benefits. There are other natural substances, marijuana, that may help with nausea, vomiting, anorexia, pain, neuropathy, insomnia, anxiety, and depression. But like other over-the-counter supplements, marijuana is not regulated by the FDA. So you need to seek advice from a professional and obtain it from a reputable source, because there's nothing like a little lacing with cocaine to keep you on your toes. In addition, marijuana may increase side effects or worsened symptoms such as depression, anxiety, paranoia, sleep disruption, restlessness, rapid heart rate, low blood pressure, disorientation, dizziness, hot flashes, and decreased GI motility. But I'm sure it's worth it. Natural therapies often cost more than generic prescription medications, and sometimes the effects are a little bit more subtle, so the mild benefits may not justify the price. One of these bottles of essential oils can go for $30 to $50 on Amazon, and I'm a huge fan of essential oils, and they can last you for a long time, but sometimes I think that those just aren't quite justified by the cost. If it doesn't help you, you're still out $50. In case you wanted to know, the cost of IV vitamin C is about $125 to $160 per session. And in my basic Google search, it looks like marijuana costs about $4 to $6 per joint. There are over 50,000 supplements on the market today, and it's a $30 billion industry, so you cannot rely on money-hungry retailers to provide you with a safe product. Many of them are diluted or are contaminated with toxic substances. Integrative physicians will look to companies like consumerlab.com, which tests the supplements to ensure they have what they say they have, and they'll also look for natural medicine databases to help them guide patients to find the right brand and doses. So now that we've gotten all the precautionary talks out of the way, we can go over the more puppy dog and rainbow portion. So I agree with the Society of Integrative Oncology that we must rely on the natural healing power of the organism and consider the body's innate capacity for self-diagnosis, self-repair, regeneration, and adaptation to injury or loss. We know that diet, exercise, sleep, stress reduction, and relationships are proven to affect our genetic expression. My favorite book on the subject is by Deepak Chopra called Super Genes, so check that out if you want to learn more about that. Psychological distress is a common symptom in cancer, and it affects about 80% of cancer patients. Integrative providers and conventional providers all agree that a multi-modality approach is the best, including both pharmacologic therapies, along with counseling and support groups and mind-body therapies. One specific type of counseling is cognitive behavioral therapy. And within cognitive behavioral therapy, a therapist will sit down with a patient for about 50 minutes per week. At the beginning of the session, the patient will identify a problem they want to work on. The therapist will help them set goals and change thought patterns and behaviors. They'll agree on a homework project. So a patient with anxiety, for instance, will keep a diary of symptom triggers, and then they'll learn to cope by avoiding those triggers or gradually introducing themselves into those situations again. The evidence for this long-lasting therapy is strong, so the cost and time is well worth it. So definitely don't feel bad about spending the extra time on this. Mind-body therapies that have been shown to help with psychological distress, specifically in cancer patients, include yoga, progressive muscle relaxation, guided imagery, acupuncture, massage, healing touch, and music therapy. Yoga is one of the most commonly performed mind-body therapies, and it's shown to help with anxiety and overall mood and mental quality of life. Like other exercises, certain yoga poses will release endorphins and create that feeling of euphoria. See, we don't even need marijuana to get high. So there are several different types of yoga. Bikram Yoga specifically is performed in a hot room heated up to 110 degrees Fahrenheit. So take caution if you're considering this, because it can lead to dehydration and then worsen symptoms like nausea, vomiting, and fatigue. There's also angry yoga, which many find to be releaseful. You can perform doga, or dog yoga. There's now yoga with goats, and beer yoga. So you just have to find one that works for you. Mayo Clinic offers some of the more standard and gentler yoga. So it's just $10 per session. It's open to the public. And you can sign up online at MindBody Online and just type in Mayo Clinic, Arizona. Another mind-body therapy for psychological distress is guided imagery. It's the use of words and music to evoke positive imaginary scenarios. So many people will imagine a beach or a pretty sunset. I personally will imagine sitting on the back porch, listening to a deafening thunderstorm with a glass of wine and a chocolate truffle, but you have to get creative with these sort of things. There are many substances that do help with psychological distress, and all of these listed here have some compound in them that affect the listed brain chemicals, which are implicated in mood, anxiety, depression. But many of these are contraindicated during chemotherapy, or they contain rare but serious side effects, so you need to be guided by a physician again. Insomnia and fatigue affects up to 50% of cancer patients, and pharmacologic therapies are often cause dependency and have side effects, so sleep hygiene is the mainstay. And most of you know these, but just to recap, the main components of sleep hygiene include avoiding naps, avoiding stimulants, alcohol, and large meals in the evening, exercising vigorously at least 4 hours prior to bedtime, ensuring 30 minutes of sunlight and keeping the bedroom dark, establishing a bedtime routine, and only using the bedroom for sleep and sex. A side note, sex actually promotes sleep as well through the release of oxytocin, which is a feel-good hormone that induces relaxation. So there is some good news. Cognitive behavioral therapy helps fatigue and insomnia as well, and it's shown to improve fatigue in up to 30% of cancer patients. And there's emerging evidence that a new online cognitive behavioral therapy from shuteye.me can help improve insomnia. It's about $135 for 16 weeks of access, and you get access to 6 sessions of therapy, a sleep diary, the personalized sleep window, progress reports, and even integration with your Fitbit. Exercise has been shown to help, not hurt fatigue. Light to moderate exercise has really good evidence, including walking, yoga, and qigong. Now, I do have patients that will complain of worsened fatigue after exercise, but I really believe that's because they've been so deconditioned and have poor stamina at the beginning. So after several sessions, I think that it'll get better, so just stick with it. We think that the improved muscle strength, the improved mood, and the decreased inflammation all help to improve the fatigue. So just start really light, 5 to 10 minutes per day, and then gradually increase your duration and activity. Yoga is a mind-body therapy that helps with insomnia and fatigue. In one study of 401 cancer patients, half of them randomized to the yoga group had better global sleep quality and decreased time awake after sleep onset and decreased sleep medication use when compared to the controls. Progressive muscle relaxation is one of my favorite mind-body therapies for insomnia because it's something everybody can do while just lying in bed. And all you do is squeeze your facial muscles for several seconds and then release them, and then move along down the body. Guided imagery has been shown to help insomnia, and acupuncture, therapeutic massage, and mindfulness-based stress reduction have been shown to help with fatigue. So there's evidence for all of those. There's now evidence that fatigue in cancer patients is related specifically to inflammation. In one study of breast cancer patients with higher levels of CRP, a marker of inflammation in the blood, reported increased levels of fatigue. We know that the Western diet will increase both inflammation and fatigue, but incorporating omega-3s, whole grains, fruits, vegetables, and fiber will lower inflammation. If you don't like fish and you choose a fish oil supplement instead, make sure that it is micro-distilled, pharmaceutical grade, and make sure that the long-chain omega-3 fatty acids, EPA and DHA, equal 1,000 milligrams per day for the best results. Ashwagandha is also known as Indian ginseng. It's an adaptogen that decreases cellular sensitivity to stress. So breast cancer patients who were given 2 grams of ashwagandha reported less fatigue and better quality of life. Melatonin is a natural hormone released by the pineal gland starting at around dusk and increasing throughout the night. It regulates sleep cycle and lowers body temperature, but it's disrupted by blue lights. So this is why you're supposed to keep the iPads and the TVs and the cell phones out of the bedroom, because those will be disruptive in more than one way. You can start with just 1 milligram. We recommend taking it at dusk. If that doesn't work for you, you can increase all the way up to 21 milligrams gradually. It's been shown to be safe, taken for several weeks in a row. Valerian Root is also used for sleep promotion. It decreases sleep latency, or the amount of time it takes to fall asleep, but not necessarily sleep quality. I recommend taking the proprietary blend of Valerian Root. If you take the hot tea prior to sleep, the heat might disrupt your ability to fall asleep. Chamomile has compounds that can decrease nighttime awakenings, and it has a similar effect to Xanax. And L-tryptophan can increase total sleep and non-REM sleep. Cancer-related pain is also another common symptom, and it responds well to mind-body therapies. The one we'll cover now is acupuncture. So acupuncture has been a part of traditional Chinese medicine for over 1,000 years. It involves the use of tiny needles placed in certain meridians or paths in the body to stimulate qi, or your life force energy. It's shown to reduce chronic back pain, neck pain, knee pain, and headaches, and it's very safe when done by a licensed practitioner. Massage has its best benefits actually for improving anxiety, but emerging evidence is showing it to improve cancer-related pain as well and improve quality of life. At Mayo, we have massage therapists that are certified in cancer-related massage specifically, and this is important because they know how to avoid certain locations in the body that either contain cancer or locations of previous surgical sites. Other mind-body therapies that help pain and neuropathy include yoga, cognitive behavioral therapy, guided imagery, progressive muscle relaxation, and even hypnosis. Who knew? So exercise has been shown to help pain. It lowers pain severity and lessens the use of pain medications, and we think this is through the use of endogenous morphine. Supplements that help neuropathy specifically include N-acetylcysteine, vitamin E, alpha-lipoic acid, curcumin, which is found in turmeric, omega-3 fatty acids, and L-glutamine. Another symptom, a common symptom for cancer patients is nausea and vomiting, and these are often related to weight loss. So it's hard for people to increase their caloric intake to make up for that weight loss when they're dealing with nausea and vomiting from their chemotherapy. Ginger is one of the most widely prescribed supplements used for this. I think it's soothing to take in the form of a tea, so you just boil water, turn off the heat, and then let 1 tablespoon of grated ginger sit for 10 minutes, and then add what you like. My colleagues think that ginger capsules taken 30 minutes prior to a meal are really effective as well for indigestion. And we know it works on similar receptors in the gut as the newer anti-nausea medications like Zofran. Mind-body therapies also help in nausea and vomiting, including yoga, acupuncture, hypnosis, progressive muscle relaxation, and guided imagery. So I hope you've noticed a theme here, and that's that the mind-body therapies help all cancer-related symptoms, and they can treat them simultaneously by affecting the whole body, mind, and spirit. And we know that those lifestyle changes like diet, exercise, stress reduction, and cultivating strong supportive relationships are proven to alter our genetic expression. So again, we'll use the natural healing power of the organism through these if we can just transform even one small thing at a time. Some other mind-body therapies I just wanted to touch on briefly include meditation, and there's several apps for this on your phone to help you. Reiki, which is kind of an energy type of therapy. Art therapy, coloring mandalas, music therapy, pet therapy, gratitude meditation, volunteering, spirituality, and prayer. The point is that you need to get creative and find something that is engaging for you mentally and physically. My husband's favorite therapy is volunteering at the Barrett-Jackson auction. And then he comes home and he tells me about his favorite cars. This is a Bugatti Veyron Supercharged 300, and I had to practice that. And I don't know what it means, but the point is that this is what really makes his heart sing. So do what makes your heart sing, and do it often, and I promise you'll feel better. That's it. Thank you.